Hi, I'm Holly Sakala. I am your host for this.
Start over.
All right. You don't normally yell it out. Normally they just go and whatever.
Yes. Okay.
Hi, so I'm Holly Sakala. I am your host for this month's Recovery Talks episode. Today I am joined by Gary Bliss.
Hello, Holly.
Hello. Director of Government and External Relations for the Providence Center. Joined the team in July 2013.
Correct.
All right, so tell me a little bit about the Providence Center. What is
Sure.
their role in the recovery community?
Sure. Thank you very much, and thank you for having me on today. The Providence Center is the largest community mental health center in Rhode Island. We have a comprehensive array of services for children to adults, from people as young as 3 years old to people as old as 85 or older. Inpatient, outpatient, mental health services, and also a lot of services for the recovery community for people with substance use disorders. We're an active partner with the Anchor Community Recovery Centers, with RICARES, and it's an organization that has an overall commitment and belief in recovery, in a belief that recovery does work and that people's lives can be made better, whether those are people who are living with mental illness or people who are living with a substance use disorder, working their way through or towards long-term recovery.
That's good stuff, Gary.
Yes, it is.
Good stuff.
It's a great group of people to be working with.
I tell you that I'm most impressed in their commitment to the continuum of care they offer their clients, patients, members, making sure that Recovery Center is available to anyone who has finished treatment.
Yes.
Or gone through counseling,
Right. So
etc.
we've got the Anchor Community Recovery Center in downtown Pawtucket. That was the first of its type, opened in Rhode Island, open 7 days a week, offering an array of activities. People can connect there with a group, they can connect there with a recovery coach, they can go there for resume help, they can look for a job, or they can just make a connection with someone else in recovery. We also hosted there a few weeks back a gubernatorial forum where we invited all of the candidates for governor to come, and we had questions that were specifically related to recovery. And the recovery community was there, and just by attending alone, they sent a powerful message to the people running for governor that the recovery community is here, the recovery community needs to be noticed, and that the recovery community votes.
Oh, we vote.
Yes.
Gary, we make sure we vote.
Yes.
We make sure we vote. So So talking about the gubernatorial candidates forum that we had, you've been involved with government for some time.
Yes.
So maybe you could tell the folks at home how they can get more involved. How can they be an advocate for the recovery community, whether it be their child, their mom, dad, neighbor? How can they make use of that advocacy time to help their neighbors?
Sure. Thank you. Would love to. First off, register to vote. If you are not registered to vote, do go out and register. And there are places that you can turn to that can help you register. Next, do some basic research. Who is your state rep? Who is your state senator? Who is your mayor? Are they up for re-election? Do they have an opponent? What are some of the issues that are in that campaign? Next, reach out to that office holder, reach out to those candidates, ask for an appointment. Just as you would ask for an appointment with a doctor or any other official, ask for an appointment with these people. You are one of their constituents, and you have a right to ask for an appointment. Meet with them, and share with them your story. Share with them information. Everyone comes to every single issue, whether it is recovery, behavioral health, healthcare, the economy, jobs, you name it. We come to it with different information, with different experience. Your appointment is your chance to bring your story, your experience, the information from your life to an elected official.
That's fantastic stuff. I mean, we're all about sharing the story. The recovery community is, we foster that kind of, just that kind of way of being. Sharing your story of hope can really reach out to another and not only educate others that have no idea about recovery or addiction, but it can really foster that little seed of hope for somebody that may not know.
And it's important to mention that idea of hope because, needless to say, in the news, whether it's the news on TV, radio, or in the newspaper, oftentimes we're seeing headlines that are quite depressing.
True.
We're seeing bad news.
Very true.
And oftentimes when an elected official is having an appointment, they're meeting with people who are discussing a problem. If you can talk about what works and how things can be made better, well, then that's going to make your conversation a much more positive and memorable conversation.
Productive.
Exactly. And what is excellent about talking about recovery is you are talking about something that works, and you're talking about how that person can support something that will make a difference, how they can be part of the solution. And everyone wants to be part of the solution.
I definitely want to be part of the solution, Gary.
Exactly. So you, by talking to them, can share with them how that's the case. You can also make yourself a resource by making yourself available to answer questions, to let them ask questions off the record, and just help them educate themselves. Let them ask any question they have, and it may seem silly, but you're going to help them be able to understand more the issues. And when they increase that understanding, well, then they're going to be able to do even more, whether it's as a state rep, state senator, mayor, governor, what have you.
Absolutely, some great advice. Register to vote, find out who's representing you, and make the appointment. So Gary, tell me what's kind of on the rise for the Providence Center. What are some of the initiatives they have kind of moving forward, that they've done all this good stuff to get up to speed, making sure they're supporting the recovery community, really being active in moving behavioral health forward?
Certainly. So some of the exciting things that have been happening, we've just finished, by the time people see this, we will have just finished Recovery Month, and the Providence Center with RICARES, Anchor, Buddha, and many other partners has been very active throughout the month. We had a fantastic rally, as we always do. And some of the other things we've done recently, we have, with funding from the Department of Behavioral Health, Developmental Disabilities and Hospitals, have been able to connect recovery coaches, certified recovery coaches, with people who have been brought in to an emergency department because they have overdosed. These are individuals who have survived an overdose, and thanks to that funding from the state, which the governor announced at Anchor, and thanks to the training that these people have gotten, we're going to connect someone in need with a peer support specialist, someone who has been there themselves, who knows how difficult it is, but also how possible it is to recover.
The experience of survival is definitely very useful in that situation.
Yes.
And the program is going pretty well.
It's going very well. Pretty much every single weekend we are reaching out and connecting with more and more people. And these are people who are living, people who are surviving. And we're pointing them where they can go and get help.
At the same time, we're able to educate healthcare professionals more about addiction and recovery.
Yes.
You know, it's tough for healthcare professionals because they're always seeing the crisis end and not so much the recovery end. So it's nice to be able to educate them, or at least expose them more to people in recovery.
Exactly. And also family members, because the family members are going to be in there. And we've been doing a number of forums over the past year where we've been talking to family members about how to look for the warning signs, recognize the signs, realize what are the risks within your house that addiction could be taking place, and where can you turn to for help.
Yes, I mean, Anchor, the Providence Center has been involved in a number of different community activities, take back days and public forums. Not only that is, we have the GRASP group.
Yep.
for people that have family members that haven't made it through overdose or addiction, alcoholism, and they've lost it. So we have grief groups available for those family members. Learn to Cope just came to Rhode Island. I'm very excited to hear
Yes.
about this.
Excellent.
So the community is really happy about that. So we really are reaching out to the family member too. They can always walk into Anchor and ask about resources for their loved ones.
Pretty much no matter what your experience is, you are not alone. There
it.
is someone else out there who has had the same experience you have had, and you will do better if you can find those other people, connect with them, learn from their experience, and also help them with their recovery. Because when you're helping
Can't keep
someone
if you don't
else,
give it away, right?
exactly, you will really be helping a great deal. Something else, which will have been announced by the time people are watching this show, we, in partnership with a number of other community organizations and some real community leaders, are creating something new called the Recovery Works Coalition.
Exciting.
Yes, this is a group of people coming together to spread the message that recovery works. And we're trying to change the way people talk about and treat and respond to the issue of addiction. And Rhode Island has some of the highest substance use disorder rates in the country. And when you have rates as high as we do in Rhode Island, it is something that affects every house, every street, every business, every school, every church, every temple, every synagogue. And we need to make all of these places somewhere where it is safe for a person to say, I need help. I need help for myself. I need help for my husband, my wife, my son, my daughter, my friend. It is a workplace issue. It is a workforce issue. And as we try to turn around the Rhode Island economy, as we try to have the Rhode Island economy recover, we need to deal with the issue of recovery, and we need to deal with the issue of addiction, and recognize that the missing ingredient so often in someone who gets the intervention, in someone who gets the treatment, the missing ingredient so often is recovery. That's the key to long-term success.
Oh, I'm a believer, Gary. I am a person in long-term recovery, and I had the benefit of meeting other people that had recovery, and I didn't have that stigma stopping me or burying me, no barriers in the way, so I was able to get the help I need. And now, you know, more than 11 years later, you know, I'm not incarcerated. I've got a job, I'm doing well, my family's doing better, so recovery works. I'm definitely a believer.
Yes.
So I'm really excited that these new things are on the rise.
You and I have a mutual friend who recently has been battling with cancer.
Right.
And when his treatment ended, that did not end his interaction with the people giving him medical care.
That's right.
No, it was the beginning of a new chapter in the care, and that was sit down, we're going to talk about your next appointments, because we're going to see you 3 months from now, 6 months from now, 9 months from now. Mm-hmm. It's also how are you going to change your life on a day-to-day basis so that we can keep you cancer-free. If we're really going to recognize addiction as the disease that it is,
Public health issue.
we need to recognize that just as diabetes, asthma, and other diseases require a long-term plan to ensure a healthy life, same with addiction.
Right, a lot of the things that Anchor does to kind of enhance that recovery process is the partnership with the YMCA, nutrition classes, self-care classes, financial stability classes. These are all things that Anchor really does bring to people in the recovery community,
Yes.
I mean at large, so
Yes. And
those things are good.
Yes, and I'm glad you brought up the YMCA. That's another great partnership. We believe that it is unique in this country to have a recovery community center on the campus of a YMCA. And it really helps to reinforce the message that recovery is about a healthy life and a whole healthy life. And that includes exercise, it includes involvement with the community, it includes recovery-based activities, and we are delighted to see the things happening there and the events that both organizations are putting on.
Right.
And where does Anchor begin? Where does the Y begin? It's wonderful, and it's beginning to blend.
It is kind of turning into like a ROSC model, recovery-oriented. I can see that. I see a lot of folks coming in and out of the Anchors, including myself. And I've benefited from going to the Y. So, you know, those checkups are really kind of important for the whole health of somebody. And I think that the community that is growing now is kind of surrounding that, so that it touches all bases, like the homecomers that are coming home from the ACI.
Yes, that's
right?
another great group.
Homecomers that are coming home from the ACI, they are going to return to the community. They have moms, dads, sons, daughters out in the community. And the Providence Center and Anchor have a unique program with recovery coaches inside there.
Yes.
Tomorrow is the rally behind the walls, or I like to say within the
Yes.
walls. But we're doing some great stuff there.
Yes, and that's the third anchor that we have, and again, we believe unique in the country, inside women's minimum security. And I have had the pleasure and the honor of attending some of those meetings, and they are incredibly inspiring. But what is really inspiring is when you get to meet again the women who you met when they were inside, when they are out and in the community, and you see the smile that lights up their whole body, that lights up their whole spirit. And what is wonderful is Anchor gives them a community that believes in them, a community that believes they're going to succeed and connects them to other people who are going to help them succeed. Because let's be honest, many folks who have gone to prison have worn out their welcome with some of the people who should be friends and allies.
Indeed.
And this is a group that believes in them, that knows that thanks to Anchor Recovery at the prison, that they are emerging stronger and better.
Beginning to empower them before they even leave.
Exactly.
So empowering them to take action, take responsibility for their health choices and things of that nature really has shown great improvement in the reentry homecomer, I like to call it, reentry homecomer population.
Yes.
And Anchor does a good job with the groups now, so we do see a lot of folks coming and growing in those ways.
And we're seeing the recidivism rate decline. We are seeing folks stay out, stay in the community,
At
get jobs.
$75,000 a year for a healthy inmate, I'd say that's pretty good.
It is an excellent investment.
Yes.
To invest in recovery.
It's a good
and to
investment
connect
all
folks.
around.
We need to expand that. And the Department of Corrections, AT Wall, and others would like to see that. Rhode Island is in a tough place right now, but we should be expanding that to the men's side and expanding it on the women's side as well, beyond women's minimum security.
Great stuff. Great stuff. I'm always excited about hearing about these new programs pop up. And the Recovery Works Coalition is definitely exciting. I mean, Anchor has been involved in multiple rallies over the Recovery Month and part of the Recovery Month planners with SAMHSA. I mean, exciting stuff that one of our own, Tom Coder, is now down there.
Yes.
Kind of schooling people about
getting the national
Yes.
recognition he deserves. We'll be announcing the Recovery Works Coalition on October 1st. So the day after Recovery Month, because our message is every month we need to be focused on recovery. And some of the groups who've stepped forward already and joined, I think really will speak to the diversity of the coalition. So we're Rhode Island Manufacturers Association, the Construction Trades Union, the Painters Union, Data of Rhode Island Drug and Alcohol Treatment Association, Phoenix House, and more. We're in conversations with many professional groups that recognize that it is an issue within their field, but also they have a responsibility to the community as a whole to join in stepping forward. And this is a way we can put the stigma of this issue behind us.
Ultimately saving a lot more lives.
Exactly.
And a lot more families.
Exactly. There is a business I was talking with recently that performs drug testing for new job applicants. 50% of those who apply, their applications are rejected right away. Now these are folks who are even applying for a job where they know they will be tested.
Wow.
If you think of this from the perspective of an employer, this is a serious issue. Now this business is located here. They are not leaving, they can't leave. But for another business that could pick up and move, they might. Or another business thinking of moving into Rhode Island might hear a story like that. What we need to do is we need to change the facts on the ground here in Rhode Island. And the way to do that is to connect more people with recovery.
I am so in it to win it.
Excellent.
I think the recovery community should be on every street corner, every school, everywhere.
Yes.
Because it's just a good way to live. It's definitely enriched my life, and I see that joy of recovery spread every day. Thousands of people, like you were saying, the Recovery Month activities, we definitely got to see thousands of people celebrating health.
Yes, and
Good health.
across the state.
And across the country.
Yes, and
Wow.
Rhode Islanders going to Washington, D.C. this past weekend. That was fantastic.
Yes.
To see some familiar faces right there in front of the White House.
Yes, absolutely. Anchor and Rhode Island Cares really does help foster people to get to know who's out there. How do we promote recovery? How do you get involved? How do you be a responsible community member to people in your communities, you know?
Exactly.
So it's all about rebuilding.
Yes.
So another question I had, so as the peers are utilized throughout the Providence Center, pretty unique, but I see a lot more folks in this particular business kind of gravitating to utilize peers within their treatment system. And so I think that I've seen Providence Center obviously be the lead in this kind of movement to peer services. How do you think peer services have really impacted those?
The peer service model has a big impact within the Providence Center, and we try and use that as many places as we possibly can.
We're happy about that.
Yes. Because there is no more powerful spokesperson for the issue. There is no more powerful connection that can be made with someone than someone who has been through that experience themselves. An individual in a white coat with a stethoscope is going to be very well trained, but that can also be a very intimidating experience. And while that person can prescribe what is the right path to take, what are the right medicines to take, someone else where there is not that barrier, who can make the personal connection, who can talk about shared common experience, well, then it's possible for the person to imagine what their future is like, to see that their future could be as good as what that peer support specialist is providing.
Recovery is good, Gary.
Yes,
Recovery is good.
We hope in the coming months to work out the issues around connecting peers with folks who are brought in for emergency medical treatment for chronic inebriation. Currently, they're brought to an emergency department of a hospital. This is not a good situation for an emergency department.
No.
It is not a good situation for that individual. Neither is being well served. If we can find if we can successfully identify those folks who do not have other urgent medical issues that need attention, but we can take them to a different location, one that can provide a bit more support and can also connect them again with a peer.
And that recovery community cohesiveness.
Begin the process of recovery from that moment. And maybe that's someone who they remember. Maybe it's someone who, a year, 2 years ago, they were drinking with them. Well, that person has taken the steps towards recovery. It's then possible for the other person to do the same.
I'll tell you, I've seen the recovery community behavioral health field just really explode with new possibilities just in the last 3 years. I didn't ever see these kinds of things early in my own recovery. They just weren't available. And I'll tell you, Rhode Island really has some of the most wonderful people working on this situation just to get these things.
We've got great leaders. You, Jim Gillen, and many, many others.
Yes.
And I think that it's a very optimistic time for the field. I think what's very good is with healthcare reform, we've gotten one of the major issues that was blocking our ability to move forward. It's not completely dealt with, but it is much better dealt with today than it was 1 year ago, 2 years ago.
Absolutely.
Now is the time for the really revolutionary work of healthcare reform, and that's changing the way we deliver care. And that's going to be looking at the whole person, recognizing our head is connected to our body.
Yeah, I'm so glad that they finally taken that and made it their own. I never understood that part, but yeah, you know,
Yes.
I'm really glad to see that finally taking hold and kind of motivating the way the field is moving, because
Right.
you can't separate the
Exactly.
two. It's one person. You got to treat the whole, and your really unique care is definitely pertinent to a person recovering.
Yes, and that's what recovery is all about. It is about the whole life being healthy, having balance, and having hope, optimism, and that's why we're excited to be a part of this.
I tell you, I am pleased as punch, because we're just coming out of this recovery month, and we're saying, well, how do we keep this momentum going? And so we're happy that this Recovery Works is coming.
Great.
Available. People that are interested can always check out the website. You can go to anchorrecovery.org. You can go to RICARES.org. You can go to TPC.org.
Yes.
These are all good resources that you can kind of look up and see how you can get involved. You can walk through the door of an Anchor. All are welcome. Come on in, find out what you can do to help support your community, your family, your friends. Gary, we have a few minutes left here. So what do you think is, I'm trying to come up with a great question, because you know I love to pick your brain. So what do you think is next, just a quick one, a little thought on what does it look like? We're looking at having a new governor in town, right? New governor's coming into town.
Yes, we're going to actually have a lot of new office holders. We will have top to bottom, statewide new office holders. This is a real opportunity during the election for folks who have a platform to speak up, for individuals to connect with candidates, because now is the time they're going to be out there shaking your hand, looking for you. When you have their attention, when you have it for that moment, speak up for
That's
recovery
right.
and tell them you want them to be on the side of recovery when they are elected. We'll then move into the transition period, and that's after the election, before they take office. And this is another time where we can have a real influence on what happens next. And we're going to be ready, we're going to be prepared to work with those folks who are elected in November, so that when it is January, they're going to hit the ground running, and hit the ground running with recovery.
Yeah. Constituency of consequence.
Exactly.
Right.
And then it's a question of continuing to show up, of when there are hearings, be there. When an issue is before the General Assembly, call, email, write, be heard. You have to vote.
Recovery voices count.
Yes, you have to vote, but you are a citizen 365 days of the year, and you need to be speaking up on this issue around the clock and all 4 seasons of the year.
Yeah, I mean, you don't just, cast your vote and then become,
Correct.
silent, or I wouldn't. Anyway, that's just not me. But you got to stay active, all the time.
Correct, and stay engaged.
And Anchor definitely can help you with that. Rhode Island Cares can help you with that. 249 Main Street, Pawtucket, Rhode Island. You can walk right in. You can get some information on how you can get involved. We work with several other agencies to help get people registered and kind of engaged.
And one last point I would make, remember to say thank you. So elected officials get people asking them for a lot, and they listen
Very true.
And they listen to a lot of complaints. When someone does the right thing, when someone stands up, when someone votes, when someone speaks out on an issue, remember to say thank you.
Civil service is not the easiest job in the world.
It is not, no.
Right? It's not the easiest job in the world. So a thank you is always good.
Yes.
No matter what job you're doing. I'm thinking that's always appreciated. So we were very thankful that we were able to have the gubernatorial candidate forum.
Yes.
Right now we're trying to set some dates for another candidates forum this month. We're hoping that we'll see some of the candidates come out
Great.
back to Anchor and see a vibrant recovery community like they did last time.
Excellent.
And we're kind of looking forward to that. Hopefully you'll moderate for us,
I would
Gary.
be happy to again. I enjoyed the first one. I enjoy the next one. Great.
I'll tell you what, we're just about to close today, and I want to thank you very much, Gary.
Thank you.
And always take our thanks back to the Province Center. They really do support Anchor in every way possible, and we are so happy about it.
Great. Thank you very much.
Again, check out the websites, anchorrecovery.org, Rhode IslandCares.org. You can reach Anchor at 401-724